And if you feel it feels like paper, but when it gets wet with the blood and everything, it will react very much like our own cusps. And basically, they will insert it in the wall in between. This is an AV valve, pretty much. It's not a semi-linear valve. So that's a demo there.
Sorry, Professor, what was that called again?
This is a prosthetic valve.
Okay.
It's an AV valve. So they put it in patients
tricuspid.
that are getting a new valve. Yeah, tricuspid.
Do those last a long time? Like,
Yeah,
You
you
have
know,
to get
a lot of
replaced.
prosthetics, whatever you get, whether you get a hip replacement or, they're at least 10 years. Yeah, so it just depends. And it also depends on the condition of the heart, whether the heart can handle having that implanted in it or not. All right, now, this is a preserved sheep heart. This is fresh. So you notice there's a difference in the colors, obviously a difference in the smell. There's also a difference in the texture. So it's kind of nice to work with fresh because the walls are very flexible. Then you can distinguish several structures. You'll also notice the color of the fat. This fat is white, which if the sheep had eaten more fruits or vegetables that had beta carotene in it, then this fat would have more of a yellow color to it. I don't know if this yellow is because of it's being preserved for so many years. So, when you look at the heart, to tell the difference between the front and the back, you want to look at the direction of the apex. So the front of the heart is going to have the apex pointing to the left. You can also tell the direction of where the sulcus is, atrioventricular sulcus. So this would be the right ventricle, this would be the left ventricle. This is the anterior interventricular sulcus, and this going all the way around is the coronary sulcus. The coronary sulcus is separating the ventricles from the atrium, and here are the atrium. Now in this sample, you're seeing a lean atrium on this side and a very fatty atrium on the other. Here, in your sample this way, it's been cut, so let's try this one. When you look at it this way, here's your fresh heart. A or B? What's the front? A? Yeah, A is the front. So here you can see the apex, you can see the anterior interventricular sulcus, and this going all the way around is the coronary sulcus. Okay, now notice the coronary sulcus has a lot of fat. So that's your grooves of fat and blood vessels. And then this is your atrium. So here's the right atrium and the left atrium. Now in your book, you'll notice that the edges of them are called auricles because they look like little earlobes, okay? And the chamber actually has a wall that seems like it's collapsed. When you stick your hand in there, you see that it does have some flexibility to it. So the chamber is what's filling with blood here, and really there's not a lot of blood coming in these little areas, which is the auricle, okay? All right, now, I don't remember what your lab manual had you guys do, but I think at first it had you identify the structures on the outside. So any questions on the structures on the outside? Okay, so anterior interventricular versus